Well, here we are. It's the respiratory season. So flu, COVID, and RSV is upon us, my friends. The conversation is vaccinations, right? Been a change from the FDA and what FDA considers to be a necessary vaccine and what isn't. Oregon, Washington, Hawaii and California have come together and they've formed this West Coast Health Alliance. And they've looked at vaccination recommendations. They've looked at flu, COVID, and RSV. What are those recommendations? And they've leaned on 3 professional societies and they've looked at those recommendations and then come together and said, okay, this is what's going to be our kind of marching orders. They've put together a schedule, and in there it talks about COVID and age restrictions in kids, and then a caveat that says that anyone that chooses to get vaccinated. You no longer have to jump through a bunch of hoops. You don't need to go to your doc to get a prescription. As of yesterday, you can walk into any pharmacy in Oregon and get either flu, COVID, or RSV if, again, it fits that recommendation and that schedule that's been put out by the West Coast Alliance. So it's widely important, in my opinion, to use what we know at our disposal for infectious disease and public health, and vaccines is in that mix, especially if you're around those that are immunocompromised, older, super young. You do the vaccine because it confers benefits to other people. It's not always just about ourselves, but that's how public health works. So get yourself vaccinated.